Well, good afternoon, everybody, and welcome to Problems Prevention Evidence-Based Public Health. My name is David Brown, and I am an engagement specialist with Region 4 of the Network of the National Library of Medicine. Uh, and again, this is one of the courses we do offer from our National Training Office, specifically to help both public health professionals and library professionals learn more about evidence-based public health. So the Network of the National Library of Medicine is a 7-region organization spread out across the United States. Each state has its representation, and it includes territories and areas across the globe. So again, we are there. We are sort of the boots on the ground for the National Library of Medicine. We are the ones that are out there in the communities trying to work with public health professionals, librarians, non-government organizations, and others that are interested in spreading health information and health materials to everyone across the country. I'm from Region 4, which is again one of the larger regions in the country, from the Dakotas all the way to Arizona. But depending where you live, you can definitely get in contact with your regional medical library, where they offer additional trainings, continuing education opportunities, as well as opportunities to move forward as we go along. So again, great place to go, good opportunities to connect, especially if you want to learn more or work more locally and regionally with your opportunities moving forward. So there's our map. That's us in a nutshell. And again, we're always looking forward to working with anybody who's interested in spreading and giving out more health information. All right, so what are we going to try to accomplish today in this class? We're going to describe the 3 domains of influence in public health. We're going to list the 7 steps involved with the evidence-based public health framework. We're going to talk about the idea of a PICO framework to develop research questions. And then we're going to apply search filters to find high quality research from at least 2 quality online resources. Again, if we have time, we can go a little bit more in depth where we are. We're going to definitely see where we are, and Rebecca is posting there. There is a handout to follow along here that you can take after this class, and also the course is being recorded. So again, be sure that if you miss something or you want some more information, you can come back. The recording will probably be posted in the next week or so. It takes a couple days for it to get downloaded and processed, typical Zoom processing times, but it will be out there and available for your consumption at a later date too. So I'd like to start out with a little bit of an icebreaker here. How do you define public health, or what is public health from your perspective? It doesn't have to be that there's a universal right answer here. I'm just looking for what your thoughts are, how you define it, how you think others define it, just to give me an idea here of what you think public health is. And you can type it in the chat if you can. Chat. I see Christy saying access to tools to thrive. Prevention and community engagement. That's good. Working with the community. Health from social and medical. Community health. Okay. Everything. Community health. Okay. So I see in a lot of different thoughts here about workforce, that it can be everything. It can be, community and global well-being. So again, a lot of different perspectives here, which is great because like I say, I don't think public health is one universal definition, but I will give you at least the definition that APHA gives from this thing is basically that public health promotes and protects the health of peoples in the communities where they live, learn, work, and play. So really it's about everything, as people were saying, but it's really looking at how we protect the people, the nation, and the world from these ideas of what happens. And this is a definition from the American Public Health Association, and they really do try to say, hey, that it is everything. And again, we use this and we try to improve communities. We try to do that. And that's one of the missions within our program at the Network of the National Library of Medicine, is really trying to give information to people so that they can find the information to protect them, that the communities they work, live, learn, and play. So again, it all is complementary. It all works together, and we're really trying to work forward and move forward in this area of what public health is and where we're trying to go and what we're trying to accomplish as health professionals, as librarians, as public health practitioners. Doesn't matter where you are, we all sort of work together. And that's one of the big things I like about public health, is the intersectionality of it all. It all works together. Everybody comes together. for the greater good, and it doesn't matter whether you're a young person, an old person. We all work together, and we all work to improve outcomes and health outcomes across the globe. So going a little bit more into detail, we've had some, again, these are perspectives of 10 great public health achievements in the 21st century. Basically, the ones that are been labeled are immunizations, healthier mothers and babies, the whole idea of motor vehicle safety, all the things that we've done in that, lead poisoning prevention, workplace safety, cancer prevention, control of infectious diseases, tobacco was a health hazard, public health preparedness and response, and declines in heart disease and stroke. All of these things have been great public health interventions and public health approaches that we've used and that we continue to use today. And again, we're still trying to advance and move forward our ideas to make people healthier, wealthier, and successful. Again, the health of the nation is not just individual health, it's community health, it's workplace health, it's everywhere. And again, all these things work together to really hopefully make better health opportunities both nationally here in the United States and internationally and globally. So again, really trying to improve health, make it happen, and really we can definitely use it and move forward as we go along. So again, these are some just great examples of what's been done in public health. And we really do want to see more of these continue to grow and hopefully continue to improve as we go along. So, thing that I really do like to talk about here is this whole idea of place matters. So in this chart here, we look at how the life expectancy, and this is in St. Paul, Minnesota, same zip code, pretty much within a mile and a half difference of each other, that the life expectancy in the one area is 82.5 versus 74.8. And why could that be? There could be any number of reasons we could look at this and look at it. But for the most part, it does show that access, perceptions, structural issues do exist. And that place does make a huge difference when we're doing all these things. Because again, within that 1.7 miles, the person on Smith Avenue is actually above what the county, state, and the nation is as a whole, versus the one that's 1.7 miles away is below all three of those other indicators. So again, we have to be we have to understand that place is an important part of public health, and what can we do to make that 82 that person that's on Smith Avenue be just as success, have the same outcomes as the people on Robert Avenue. How do we get Robert Street to be as good as Smith Street? And that's one of those questions that public health really likes to look at and understand and say, why is it that there's this? Is there a perceived structural problem? Is there access issues? Are there just different things? Again, it might be a little bit of an extreme example, but for the most part, we do need to understand this, and these are things that public health looks at, health information people look at, and librarians should be curious about as well, because like I say, when we see in our communities that people within a mile and a half have such drastic differences in health disparities, we have to be conscious of this to make good choices and understand where things are and what's going on to improve where we're going and what we're trying to accomplish as we go along. So now that we talked a little bit about inequity, what causes these? So we have two things. We have structural and we have social determinants of health. And each of these sort of intertwine together, but we're going to sort of break them out here differently, as do ideas. So when we think about structural inequities, these are the systematic disadvantage of one group compared to other groups with whom they coexist. And that can be racism, sexism, classism, ableism, xenophobia, homophobia, etc. Anything that's sort of already built into the structure, it's there, it exists. It's part of the whole piece that we look at and what we're trying to understand where we go forward and what we're trying to accomplish that needs a lot of work in many respects, that we have to change the structure or we have to change society to make those things hopefully go down or decrease. Then when we look at the social determinants of health, these are the conditions in which environments in which people live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risk. This is where public health can do a lot more good, and we usually spend a lot more of our resources and time in, because really when we look at it, we're really trying to say, hey, what can we do to improve those conditions? What can we do to make a person feel healthier, look healthier, do these things, and how can we make those small changes to have lifelong improvements? And some of those examples are access to food, water, housing, workplaces, education, income, transportation, etc. So again, if we can really work on the social determinants of health, there's a little bit of studies out there that say what we do with the social determinants of health can actually start working and pulling back to the structural inequities and the structural problems that we have within health and healthcare. So again, as we look at this, as we work with it, we can definitely see that these are issues that we know exist. We see them in our country, we see them in our own local counties, our own states, and we really do need to understand that both of these things are important. But again, from a public health perspective, we're going to always mostly focus on social determinants of health to really hopefully bridge the gaps in health inequity as best as possible, fully realizing we're not going to be able to get rid of health inequity. It would be nice if we could. I mean, those have always been lofty goals, but we have to accept that there will always probably be some sort of health inequity due to the structural inequities that are always going to be present in any society or any organization as a whole. So again, just some ideas here, just some background here from a public health perspective. So how do we do this? Now that we've talked about all that stuff and moving, this is where we have to start taking our actions and really moving forward with the idea of evidence-based public health. And the definition we're going to be using here is evidence-based public health is the development, implementation, and evaluation of effective programs and policies in public health through appropriate application of principles of scientific reasoning. A lot of word salad there, I know, but it really is saying that we want to make sure that we're doing programs that are based on something that has been published, that has been studied, that is not just anecdotal, that it's actually out there to do. Unfortunately, in our current potential administrations, a lot of the things they talk about in health is very anecdotal. There isn't a lot of randomized clinical trials or high quality research that's been done to support the changes they say they may or may not want to do in our health world. And that can be a little scary, but we will talk about how we find that, how we do it, and how evidence-based public health can impact evidence-based medicine and evidence-based practice in general. It doesn't just have to be in public health. It can go even within librarianship. We do try to do an evidence-based approach, especially if we're doing systematic reviews or other type of research studies. We go back and use these evidence-based approaches to move forward and look at it as we do it. So again, it's really, we want to find the best resources, use it, and use it as justification for where we're trying to go and what we're trying to do as a organization, as a group, as a professional, as anything that we really do work across and as we look at in general. So building upon that, why is this so important? We have to access to more higher quality information on what works. Again, we can spend a lot of money. We can put a lot of resources. We can do a lot of things in public health, in other organizations, in other ways. But if we don't know that it's going to work, or if there's a question there, it's not going to move forward. It's not going to necessarily do it. There's nothing wrong with doing exploratory studies, but again, it should be grounded in some theoretical foundation, some idea that this is going to work or it's been studied before. There's going to be a higher likelihood of successful programs and policies being implemented. Again, if we say, hey, this was done over in New York City and we want to try it in Boston, there might be a higher good correlation there that it might work well. The program in New York may be very easy to implement in Boston, whereas maybe a program that was launched in New York City might not work so well in rural Wyoming, where I'm from or where I work. So again, it's just looking at how does it work, where does it work, and what do we try to do as we look at it and move things forward as we go along. It can also lead to greater workforce productivity. So we really want to say, hey, we know this is working. Is it working? We're using something that's there. We don't have to reinvent the wheel every time we want to do a project or a program. It can make you more productive. It can make the programs more productive. It can really push things forward to work in those areas and really move things forward in those areas to do these things as we look at it. And then the last thing, again, I don't love it, but it's always important, especially if you're grant funded, such as our program is, or a lot of public health departments or other organizations are. You have to ensure the efficient use of your public and private resources to be sure that, hey, we're using it. It shows, we can show that there's an ROI here because we have evidence and data. And that's even more important. That comes back in this evidence-based approach, is that you're actually gathering your data to do the evaluation, to actually add more to the evidence to either support or refute what's in the evidence moving forward. Really part of a full research process, complete research process that engages and makes sure that it makes things happen, and why we're going to move forward and work in those areas in general. All right, so to really drive home the point here, we're going to talk about the Public Health Accreditation Board. Some public health departments are accredited by this PHAB to really look at, is the health department meeting a minimum set of standards to say, hey, they're meeting these standards. And domain 9 of that is to improve and innovate public health functions through ongoing evaluation, research, and continuous quality improvement. And then a substandard of 9.2 is use and contribute to developing research, evidence, practice-based insights, and other forms of information for decision making. So if you are working in a public health department or other place, this is a very important part of your accreditation standard, and you need to ensure that you are using this research, finding the research, and using it to move forward. Again, all this is out there, and it's been proven that it works a lot of the times. Not perfectly, but again, the more we do it, the more we use it, the way we can prove it or disprove that things are working in our communities and how to move forward. So when we look at our domains of influence, and this is sort of the basis of any evidence-based approach or any evidence-based thought process, whether it be evidence-based medicine, evidence-based practice in nursing, any of the domains, it really what we use here. So we have two extremes here. We rely on our experience, knowledge, and expertise. So again, we are experts. We are practitioners. We are these people. So we really do need to rely on that in some respects, because again, what we see, what we know about our communities, what we know about our people and patrons in the library world, we know what that is. We know where it is. And then we go on the other extreme here is the community needs, politics, and economics. Again, we might know what needs to be happened, but will it be accepted? Will it be brought in? Will it be part of that? Can it be brought into the mainframe and main focus of the community due to any number of reasons that may be beyond our control or may be within our control? Because again, designing a program in an urban city is going to be a lot different than designing a program in a rural community that has 500 people. So again, just looking at those things, looking at those different areas, it really does depend where you're going to go. And then what we try to do is we try to come to this middle ground here, which is what is the best available research evidence that's going to work? And that is really what we try to do. We want to say, hey, what relies on our experience and expertise? What's going to work in our community? And what do we know that's working already in some of these communities or other places? So as it comes together, we come together into that idea, and that will lead to our decisions for public health practice, which is development, implementation, and evaluation of our interventions, programs, and policies, which is a lot of what public health does. It's all about planning and evaluation of programs and implementing them and making sure they work and move forward, and really doing that to ensure that evidence-based approaches are there, are moving forward, and working in those environments that are going to do the best we can with the materials we have and the resources we have to accomplish it in general. Okay, before I move on, any questions, comments, anything I need to go back over, or are we good out there in Zoom land?
Nothing has been added to chat other than all their responses to your earlier question, but nothing else at this point.
Very good. I just like to do a check-in because I did cover a lot of material, and we're about 20 minutes in, so we're good. All right, we'll continue on here. We'll get to a little more into this evidence-based process. So as you see, this is a continual process. It's a continuum as we look at it. So it usually starts with the community assessment. Now that can be done by different organizations. Sometimes we do a community needs assessment. Other times we'll just go out there and gather information, really just find what's going on in the community. It can also be informal. It can just be, hey, you're seeing people coming in asking questions on that so that you know that there's an interest in this area. So you can do it. Then once we get that, start that assessment, we're going to start quantifying it, because again, not as much as I don't love to say it, numbers matter. Because if we don't know the numbers, if we don't do it, and this is where our epidemiology friends always get so excited because they like the numbers. They want to see numbers and say, hey, we know that this is the number of people who are smoking, or we know this is the number of people who are abusing alcohol, or this is the number of people involved in fatal car accidents. They like the numbers so that we can do it so that it can be a more justification and move forward and work in those areas as we look at it. We develop a concise statement of the issue. And really, that's where we really have to say, what is the problem? Why is this a problem? How are we going to look at this problem? And what can we do in that idea? And then based upon we have that statement, then we determine what is the known through the scientific literature. So that's when we actually do a literature review and a literature search, which is very important. And that's one of the things we're going to spend a little time later here as we go along. We're going to do some demos. We're going to let you actually play with some of our tools as well as we go on. So really, it's really determining what is there, what we do, and where we're going. We're going to develop and prioritize program and policy options. We're going to develop an action plan and implementing interventions, and then we're going to evaluate it so that we can go back and do another community assessment. Continual idea, continuous quality improvement, continual improvement to hopefully see better outcomes in your local, state, county, or nationwide, or internationally, or globally. Just depending what you're doing, where your focus is, you are going to move forward, and you are going to work in these areas in general to move this forward. So again, step 4 is where we're really going to focus on today, because that is what we do, and that's what we do at the National Library of Medicine, Network of the National Library of Medicine, is teach you how to find that materials, use it, and where you can get it, sometimes inexpensively or even free. So again, we're really about getting you to that information, making sure you have access to that information, and making sure that you can move it forward and use it as to your best ability in general. So the framework we tend to use, and this comes more from a nursing and medical idea, is PICO, which stands for patient, population, problem, intervention, a comparison and a control, and an outcome. Sometimes some people put in a T for timely. We're not going to talk about that here, but sometimes you can say you want to look at historical data, or you want to look within a specific time frame. You can do that. That's just a new thing that they've been adding to it. And I will also say, don't feel that every single question that we go over has to fit into this perfect PICO format, because some people just like to do PIOs, and you can just do P&Os. You don't really have to look at everything here, but we'll do the complete model for you so you understand it, but don't feel that it has to be done the exact way we look at it. So, and in this idea, like a patient is going to be an individual, an organization, or something that we're doing. Our intervention is going to very much focus on what we're doing. What are we doing? And again, in public health, we talk about interventions all the time, specifically looking at, oh, what are we going to try? How are we going to do this? What are we doing? A comparison or a control. We sometimes work with those, we sometimes don't. And we don't have to, because like I say, sometimes you want to have that comparison, sometimes you don't. And the outcome is always the most important. What happened from doing that with that specific group or patient? What happened? What was the outcome from it? You know, and it can be any number of things can be an outcome. And we can definitely look at that a little bit more forward. So here is a sample question that we'll look at. Does a school-based vaccination education campaign for parents increase the rate of vaccination among elementary school children compared to students whose parents did not receive the educational campaign? So in this case, we'll break it down a little bit for you. Our population, or people of interest, would be our elementary school children. Our intervention is our educational campaign. Our comparison is there was going to be nothing, so basically a true control in many things. And the outcome is the vaccination rate. Again, you have to break this down, look at it, and make it happen, and see where you can go, what you understand as you do it. Every single question can be broken down into a PICO framework most of the time, especially if it's on a clinical level. And again, I always encourage that it's a good way to look at it, because you can sometimes play around with the different pieces in the PICO framework to actually get better results and better search strategies and better search outcomes in general. So we have to build a question. So a lot of it is like, and this is sort of a cookie cutter way. Not all of them are this nice, but you can always do it. Does something influence something in a group compared to something else. Again, that's the basic structure of any PICO question that you look at. But again, you don't have to use it as a cookie cutter, but it's just a nice way of thinking about it. It's a way of putting it out there, and it just is a good formula you can use to build your questions and make them work and use them in general. So now we're getting to another opportunity to engage and do something and work together here as in a scenario here. Specifically, we're going to look at our idea of that our local community has seen a decrease in cancer screenings in multilingual refugee and immigrant communities. You, as the public health department, would like to create a community health worker program to increase the rates of regular cancer screening in these communities. No programs currently exist in the community. You need to find evidence that putting effort into a program will increase the rates of cancer screening. So what I would like you to do is try to find the PICO question here if you can. Just giving me an idea of what you think is the question, how you would structure what you think the P would be, what the I would be, what the C and what the O would be. Just here, if we need to go back over, I'm happy to go here. If you would like to type it in there, I'll give you a few minutes to think, or if you do need clarification on something, please let me know, and I will be happy to revisit or talk about something.
And David, this is Rebecca. I just put the definition of PICO into chat since we don't have it on this slide, if people are less familiar with that. So you can plug things in.
Yep. Very good. And you guys, you're getting this. You're getting this. I know it's a little tricky, especially if it's something you've not worked with before. Yeah, and I think you're on the right track. I will build it out a little bit here. But yeah, you're looking at it, you're finding it as you go, and I think definitely you are on the right track here. And I appreciate you trying. This is experimental fun. No grades here. It's all about learning and experiencing. So I appreciate the ones that took the chance here to post in chat. I do appreciate that. So let's break it down. So if we look at PICO here, we will say, so our problem or patient is the decreased rates of cancer screening in multilingual refugee and immigrant communities. I think some of you really got that real clearly. Great job of it as you looked at it. The intervention is our community health worker program. Because again, we're really trying to say, hey, what are we going to do? We're going to start a community health worker program. So that's really one that we always have to say, hey, what are we doing? It's not necessarily going to be that outcome piece and, as it could do it. Our comparison, we didn't have any comparison, so some of you really got that, and I appreciate that. And our outcome is going to be that increased rates of cancer screening in multilingual communities. So I think you did a pretty good job. I appreciate it. And like I say, that wasn't always the easiest thing to do. But again, we look at it, we can design it, we can work with it, and we can definitely have it work in your favor to do those things. And I appreciate you all participating and working on that in general. And another way of looking at it, actually a structured question, will a community health worker program increase the rate of preventative cancer screening in a multilingual refugee and immigrant population? It's a PIO instead of a PICO, and that's okay. And hopefully that gives you an idea of just how you can do it and work through it in a very quick and easy way that we sometimes look at and what we do in this area. So once we have our question, now we have to go actually find some stuff that will, or materials that will support what we're trying to do. And one of the things we do like to talk about here is this hierarchy of evidence. I really do like this pyramid because there's two things that it shows. It shows the level of the evidence, but it also shows the likelihood of you finding that type of evidence as well. So the most out there that you're always going to find is just anecdotes or ideas or thoughts. It's like, hey, this is what I think. This is what I think based on my expert opinion or whatever, or what I've seen. And that's fine, but you know what? It doesn't necessarily support a lot. It doesn't mean that it's been validated. It's gone through that whole idea. Then we get ideas, expert opinions, and editorials. Again, those are a little bit more usually going to be backed by some more of the bigger names in the fields or ideas. And again, that's great, but you know what? It's still not going to necessarily get us to something that's going to be out there. A case study, those are nice, but you know what? A case study is usually only one, two, or three people. They're very small. They're not necessarily representative of a whole group, a whole organization, a whole anything. It's just, this is what I saw come in my clinic, came into the emergency room, came into whatever, and we really do have to look at that and idea. A cross-sectional study is really nice at times because, like I say, you can just grab it and you can do a single cross-section, a little bit more control there, actually knowing that who's in there and not in there, having more inclusionary and exclusionary criterias. Then we can get a little bit more sophisticated where we can do some case control studies where we actually look at specific cases and control for them. We can do a cohort study. Nice. It's big, it's nice, and it's great. And you can get a lot. Then if you can really, if you have the money and what we really do sort of called the gold standard, whether or not I agree with that or not, whole other thing in a whole other class, talk about is the randomized clinical trial or the randomized control trial where people have an equal opportunity to be in either group and you track them and you do it and you make sure it meets that gold standard of research and rigor. And what we really like to see, especially in the library world, are these systematic reviews and meta-analysis where it really takes a bunch of randomized control trials and tries to find what is the best practice, what is the best approach, because we've looked at all this stuff, we find a systematic review, and we find a meta-analysis, and it really tells us what was there, what went through it, how did we do this, how does it work, how does it not work, and it really is sort of that gold standard that gives you what you're looking for in finding it. Problem is, a lot of times we're not going to always find a lot of systematic reviews and meta-analysis, so again, we always have to remember that's the goldest of the gold standard. But again, it's usually the hardest thing to find. Can be found, but don't always find it. And again, depending in the environment you work with, you may see a lot of systematic reviews and meta-analysis, or you may not. All right, so now we get to the fun part, which is actually showing you what we have in some of our programs here. I'm going to stop sharing for a second and pull up my web browser here so that we can actually play a little bit with some of these approaches. All right. So we are going to be working with three of our models today. The first one is our PubMed, which is our product from the National Library of Medicine. You do have a search bar that you can definitely use in general. And like I say, again, it's free. You can just type in pubmed.gov. There is a much longer thing, but PubMed.gov will get you there. It has millions of citations to articles from more than 5,000 health-focused journals. Again, a lot of we as the National Library of Medicine and NLM do is we make sure that those are accurate and in there, but we're not the ones that are publishing it. It all comes from publishers. It's all done by the publishers to ensure that they get it in there and it's in there and accurate. So again, it's there, it's available. The abstracts are always free. Some of the stuff is published open access, some of it isn't. So again, it's a good tool. And we're going to, basically what we're going to do to demonstrate, we're going to use our example, and we're going to type three terms into our scenario, and we'll just type it in here. So we're going to go immigrant, cancer screening, and community health workers. So we're going to do a search, see what we get based on that. Based on that, we got 59 results. What's a nice thing we can do here is we can do some drilling down. We can say how often we want to do it. Now in public health, we like stuff usually within the last 5 years, and just as a best practice that we use. If you want to make sure that you get full text or free full text, it's available there. Associated data. You can also see that you can actually find what's available, because remember, as I was talking about, the level of evidence. So if we can see if there is a systematic review there, and there is one systematic review available. So it's just a good way of you can do it. So like I say, you can just grab it, you can find it, and it's all there. You can also add some additional filters, especially if you're doing stuff. You can make sure it's in English. how it works if you want to look at specific ideas. It's a good little way to drill down, and you can find different ways to find resources here based on your search. I mean, you can also, if you get too many results, we can always go to doing an advanced search, where we're not going to go into this because there are PubMed classes, but you can always choose the specific field or figure out what you want to do and actually build a more sophisticated query if you would like to work in that area. So again, it's a good tool. I like to play with it. It's fun to work with, and definitely something that is available and accessible to everyone as you do it. And you can definitely design your own questions and work in it in there. And like I say, it works, and we can definitely use it to do that. I can show you some, I'll grab some more materials from there. But like I say, if we take that systematic review article that I had, we can definitely click on it and it will open it up. You can definitely find it here. It's available. You can find its citation. It gives you the abstract. As I say, this one we don't have full text, but what I will do, because this is going to come from Springer, which again, we do not pay for you to have access to Springer through National Light. Maybe some of your organizations do, but that's one way of doing it. But if we go to ones that we have the free full text on, I can do this. We can go over to the free PMC full text. It's here. You can either view it on the phone, or you can actually just download it here as a PDF file if you would like. It walks you through the whole article. It's also in full text on your left here, and you can definitely find what you're looking for as best you want to use and what you want to work with in general as you go along and as you play with these different approaches to find different things. So like I say, it is a good tool. I appreciate it. I use these on a idea, and as Rebecca says, there is a PubMed class this coming Wednesday, and if you would like to learn more about PubMed and get a little bit more in-depth experience with it, it's a great class, and it will help you find additional researchers and resources in general out there. So the next one we're going to look at is health evidence. Again, this is one that comes from McGill University. It's a Canadian or McMaster University School of Nursing in Canada. And again, it's a good tool here. We can definitely do that, where we're going to do their, we can search it, where they're going to look at 10,989 quality-related systematic reviews that we can use as you want to do it. So we can definitely go to search. We can type in our search terms, which I'll grab again. We're going to do immigrant cancer screening, immigrants cancer screening, and community health workers. And notice this time I am doing the ands just to do that. We can definitely boil it down to when it was published, from what years. And again, we'll do the 20 years that are here. You can set this. We're not going to do these, but you can set ideas here, and we will see what we get here. We've got one result, which is good. It's it's the concern they say. And what I do like about these places is it gives you a nice little summary here. So it says, one of the warnings they say is it's over 10 years old. And, they say always use the most recent, but it has been highly accessed. So that's a good thing. And, it has health evidence, it has a cost, and it has this economic evaluation. So if we click on it, it will definitely look at it. You can actually view how they did the quality assessment, why they scored it the way they did, which is always helpful to understand what happened. Okay. And it has the whole piece here. There is the article full text free. There's also a PubMed link out. So if you want to go back to PubMed and find it, you can find it. And again, it's just a good way to look at it, find it, use it, good tools there as you can find what you're looking for in your ideas to understand where you're looking for. So again, good tools, good way to use it, a good way to approach it, and a wonderful way to approach your ideas and thought processes as you go along. So, any questions on either PubMed or the health evidence sites I just went over?
Nothing in the chat box yet, but they might be furiously typing.
It's okay. Happy to cover anything more or do more examples here, but well, I will move on to our third and final demo then here to understand, and this is called the Community Guide. This is a good resource that comes from University of Kansas, and they are, oh no, now it's part of, actually it's moved to CDC now, and like I say, it's a good place to look. It talks about communities, what's going on. We can, oops. All right. So in this case, we are looking at, a systematic reviews here. There were 8 that came up when we did our cancer screening interventions. So like I said, I can take that out and we'll just do cancer screening. Actually get to 51 again. And again, we have our systematic reviews of where it's out there. So if we're looking at colorectal or cervical cancer or breast cancer, again, it's just a good approach here. It's a good way that we can do it. But if we look at colorectal cancer, basically it works. Again, where it comes from, they have a recommendation that it's strong evidence. It's a little dated as we see who the audience was, what the strategy was, and again, what the interventions were, what they found, and and then what's nice here too, if you're trying to create some educational or other materials, they have a nice one pager that sort of will maybe out there, but if we, yeah,
I know that CDC within the past year has done a major reorganization of their website. So sometimes even they have not fixed the links. So
that I was just trying to make it easy and to try to do a demo, and of course, it doesn't always work, but that's okay. And that's the thing. Yes, a lot of things have been changing, and we are coming off of a government shutdown for 45 days. So some links may be broken or may not be perfectly functioning right now. So that's your snapshot. This is what they have found in the systematic review. What the best approach is, how applicable it is. It's just a good way to find resources, and then any supporting ideas you have here. And let's see if this, and you see, and here's what they were saying, at least on their, how to do their evidence and who was done and how it was done. And, it very good, very quality way of finding resources to justify why you want to do or what you want to do in general. So like I say, a lot of fun stuff here, a lot of good materials in general. And it good, like I say, it's always a good approach, always a good way to look at things, and always, good way to find stuff. And like I say, there are also other databases and places you can look to do it and play with it in general. But like I say, you can always do it. You can always develop it and always find what you want to do out there. And like I say, it's just really giving you some tools that you can work with and work with to move forward. So stop sharing again and get ready to the next. And if anybody has any questions or comments, please let us know as we go along here. I will start sharing again. Right. And so those were the 3 demos that we had scheduled for today. In general, there are more and other places we can go, but again, they're good tools. They're good ways to use it. A couple of others that we do like to talk about that we're not going to necessarily demo is there's the Campbell collaboration. And this is a social science network that produces high quality, open and policy relevant evidence synthesis, plain language summaries and policy briefs. So it's a good place to go to find these ideas and do it, especially if you're trying to do it from a policy or legislative level, and really trying to make impacts there on how to change things in your location, your state, or your local areas. Again, good place to look, easy to search, pretty self-explanatory, and easy to work with in general. And then another one that's really good that I like is the county health rankings and roadmaps, where we'll actually let you drill in and actually look at some county health rankings and play with stuff and find different things and work in those areas that you may or may not have found in the past. So like I say, it is kind of a fun way to play. Good, pretty easy to do it. You can do it by exploring your health rankings, and you can really start to get some information on your local areas, understand where you are, and figure out what you want to do and where you would like to go in general. Sorry. And those are just different ways you can work and look at as you figure these things out and look and work in those areas to really understand what's going on, what's affecting your county and local areas. And like I say, there are a bunch of other tools too, but for the most part, that's what we really cover in this class for this. So just to sort of, any last minute questions or anything, or I'll just go into the recap here and we can move on here. Not seeing any, we will move on. So 3 big takeaways I want you to take from this class is evidence-based public health utilizes the 3 domains of influence, as we talked earlier, which is our practitioner knowledge, what's the sort of the political climate, and what can we find to support what we're trying to do. All those 3 work together so that we can actually make impacts on our ideas. You know, it follows that 7-step process that we talked about, and it's always continually improving. It's always opportunities for reintervention, reassessment moving forward. We do recommend that you use PubMed, Health Evidence, and the Community Guide to find those high-quality research, because that's where it is. That doesn't mean that if you're struggling, you shouldn't go talk to librarians or others that may be able to help you, or even reach out to your local RML because they may have additional trainings or materials they can support you or provide you with in those areas. So again, we're always looking forward to engaging with you and working with you to ensure that you have access to the best materials to make sure that your programs are successful and can be out there and improve the overall and overarching approaches ideas. We have now made it to the end.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.